You will be given an instruction sheet. So remember, every time you go into a station, you have an instruction sheet. And the instruction will just tell you what you're going to clean the wound with, and it's always normal saline, obviously. And it's always just clean with normal saline and apply a Meepor dressing, which we sent in your packs for practice, yeah? So that is all you're going to have to do. And it's simple. The scenario is also that the doctor has just done his rounds and he has removed the dressing, and you need now to go in and redress that wound. Now, there's no drugs involved, is there? So we don't need an ID check looking at wristbands. But we do need to still say hello, don't we? And be polite, find out their preferred name. And I would still ask them, are they allergic to Elastoplast? Yes? Because that is, you know, the dressing obviously sticks to the skin. Okay, so I'll demonstrate the, what page are they on? So if you turn to your marking criteria on wound dressing, aseptic technique, it's the very first one in your booklet is wound care. Page 39. You can follow me. Obviously, with this one, we've shown you with a dressing covering the wound, but we've been told that the scenario now is that there's nothing covering the wound. Okay? And obviously, yeah, so just follow that criteria and I'll explain why it may look slightly different. Okay, so let me get one ready, save me messing about. Okay, so for this station you do get 15 minutes and Anina will time me. Yeah, is that all right, Anina? So we have 15 minutes and my timer starts now. So before doing anything, I'm going to wash my hands. So turn on the taps, apply the soap, rub my hands palm to palm, fingers interlaced. Right, hand over left dorsum. Can't see a clock anyway. Vice versa. Rotational rubbing of my fingers, interlocked. Rotational rubbing of my thumb, my thumbs, my fingertips, wrists. And I'm going to rinse onto the tap, take a paper towel, pat dry into domestic waste, pat dry into domestic waste. So now I'm ready to approach my patient. As I'm approaching my patient, I'm looking at the scene that it's all safe and there's no spillage at all. Right. Good morning. Good morning. My name's Debbie. Okay. I see that the doctor's just had a look at your wound and it needs redressing. So what I'm going to do is I'm going to go and redress that wound for you. Is that okay with you? Okay. So before I start that, can I just check you're comfortable?
Yes, I'm fine.
And how would you like me to address you?
You can call me Rose.
Right, so Rose, what I'm going to do then, if you're quite comfortable, I'm just going to go off and I'm going to get the trolley and I'll be back to redress the wound.
Okay.
Can I just check, are you allergic to Elastoplast or anything?
No.
No, so you're fine with that, you're comfortable. So here's your buzzer and I'll be back.
Okay.